A really important thing that we deal with is low back pain. Something that can really affect that low back pain is actually sacral dysfunction. So the sacrum is that tailbone that's at the bottom. What happens is that gets fixated and it doesn't move. So what that does is that actually causes the gluteus medius muscle, the piriformis muscle, and the glute max muscles to get tight. And when those get tight, that causes some low back pain, radiation to the pain. So what I'm going to do is I'm going to demonstrate a really good stretch for those that you can do at home. Okay, so the first things first, we're going to stretch the left side. So what we're going to do is bring that across and bring your toes toward your knee, and then all you have to do is bend toward that left knee. So that's one. The other one is you're going to be bending forward and grabbing toward those toes, just like that. Okay, now we're going to demonstrate the right side. So again, bring that across just like that, toes toward your knee. Bend toward the knee, and then bend toward the toes. And that's a fantastic one. The piriformis muscle, sometimes that cuts off the sciatic nerve and actually causes pain that radiates toward the knee. Some people call that sciatica, and it's actually pseudosciatica or piriformis syndrome. This can really help that out. Once we adjust that sacrum, get that thing moving again, then we can get that piriformis syndrome to go away. But if you don't stretch that out after we're done working, you might have to come back in a little bit more often. So this is a fantastic stretch for that. Okay, so with that sacral dysfunction we talked about previously, there's actually a problem that can happen with the TFL muscles, which are right through here. They also call it the tensor fasciae lata or the IT band. So it goes from here down to here. They're a pretty difficult one to stretch. They're kind of complicated. So what I'm going to do is I'm going to demonstrate that for you. So what you want to do is you want to find a wall, put your hands against that wall, and then if we're going to be stretching this right one, you want to take the left leg and bring it across, and then you want to point that toe to the other side. So that left toe, you want to point to the right toe, and then you want to lean away toward that left side. Okay, so we're going to demonstrate that one more time. So we're stretching the right side. We're going to bring the left leg across and point that toe to that right toe, and then lean away to the left to stretch that right side. Okay. All right, now we're going to demonstrate the left. So what you want to do, again, you want to take the right leg, bring it across the left, point that right toe toward the left toe, and then stretch to the right to get that left TFL to stretch. And that'll help with that sacral dysfunction.